So weight management, and I think this is quite an important topic these days, and because of this. So we can see that about 66% of us are either overweight or obese. Anyone surprised? Probably not. So that slide prepared by Dr. Majid, so don't blame me. And unfortunately, that's not just us, it's actually our kids. So I found this slide quite interesting. As we get older, we get heavier. And I think there are multiple factors to do that. And I'm not specialized in this area, so I prefer to move to Dr. Majid Al-Abooud. So Dr. Majid Al-Abooud is a consultant and general physician and endocrinologist from Macquarie University, graduate with a degree of Doctor of Advanced Medicines in Endocrinology with academic excellence. He's a fellow of Royal College of Physicians in Edinburgh, fellow of Royal Australian College of Physicians, fellow of Iraqi Board of Medical Association, medical specialization, sorry, and a fellow of Arab Board for Health Specialization, and the lists keep going. So I'll stop here. Currently, Majid is a staff specialist at the Gold Coast University Hospital and associate professor of medicine at Bond University. Please welcome Majid Al-Abooud.
Thank you, Mr. Chairman. So glad to be here today. This is an old photo of me. I look younger here. So many thanks for the organizing committee, especially to Professor Ahmed Rubai for bringing us together here today in this beautiful city of Sydney. Before I start my talk about obesity, I just wanted to ask you a question. Who thinks obesity is a risk factor for other disease? Please, hands up. Interesting. This is a bit tricky. Who thinks obesity is a chronic disease on itself that lead to many, many complications? Please, hands up. Cool. Great. I think to answer this question, we need to understand what is the definition of a chronic disease. The Australian Institute of Health and Welfare defines chronic disease as any long-standing health issue that is difficult to be cured and result in impact on patients or person's health, including mental and physical health. And based on that, I'm pretty sure you agree with me, this definition fits well with obesity. So we need to change our mindset and our perception of obesity from looking at obesity as a risk factor for other disease to it's a chronic relapsing remitting disease. Cool. Now, as you know, obesity is defined based on the BMI. Any BMI above 30, this is obesity. This is quite a new classification where they've added now a new class of obesity. They call it super obesity or class 4, which is a BMI of 40 and plus. And obesity is a complex interplay of many factors. We all know that healthy food is quite expensive and it is less palatable, while unhealthy food is quite cheap, readily available, and it is it's very delicious. منو ما يحب الباتشا والكباب والتشريب مو صحيح؟ Now, many organizations all over the world, associations and regulatory bodies already recognize obesity as a chronic disease, including the Royal College of Physicians and the FDA. Obesity can result in many, many complications that can be classified broadly into three main categories: mechanical, psychological, as well as cardiometabolic. You wouldn't be surprised if I tell you that people with obesity, especially morbid obesity, with a BMI of above 40, live 10 years less than people with a normal BMI. So obesity reduces life expectancy, unfortunately. And as you know, obesity is correlated with many cancers, such as breast cancer and colorectal cancer. Now, the good news, if we lose 10 to 15% of our body weight, this can result in dramatic improvement, including remission of many diseases, such as type 2 diabetes, osteoarthritis, obstructive sleep apnea, polycystic ovary syndrome, and many, many others. The principles of management of obesity rely on the lifestyle changes, which is physical activity and medical and nutritional therapy. And there are three pillars for the management of obesity. My job today is to talk about pharmacotherapy in obesity. So on the next slide, I'm going to show you the 6 TGA-approved medications for obesity in Australia. Unfortunately, none of them is PPS subsidized, so they are private. So I'm going to start with one of the old medications. Who doesn't know phentermine or duramin? This article was published 60 years ago, and as you can see, people who were given phentermine or duramin, which is a CNS stimulant, lost almost 28 pounds, that is equal to 13 kg, after 36 weeks of use of phentermine. But unfortunately, we can't use duramin for more than 12 weeks due to serious side effects, mainly cardiovascular. And this was followed by the discovery of Xenical through the Zendes trial that was published in 2004. And the Xenical is a lipase inhibitor, so it inhibits the absorption of fat from the body. And as per the Xenical study or the Zendes study, people lost around 7 kg after 208 weeks of use of Xenical. So very moderate weight loss, but quite cheap medicine. And then that was followed by the CORE-I trial and the approval of the Contrave, which is a combination of naltrexone and bupropion. And these two medications are very effective. Actually, they are the most effective oral medicine, but the price is a big issue. According to that trial, as you can see, people who were kept on Contrave maximum dose lost 6.1% of their body weight after 52 weeks of use of Contrave. And here we go, the game changer. The first GLP-1 receptor agonist approved for obesity was the Saxenda. It's once daily GLP-1 receptor agonist with a dose of 3 milligram liraglutide, according to the SCALE trial. And people who were given Saxenda, they lost 10% of their body weight at the end of the trial. And then we had the new generation of GLP-1 receptor agonists, the long-acting one, which is the Wegovy, and 5 different doses, 5 different colored pens. And according to the STEP trial, which is the pivotal trial for Wegovy, you might be surprised if I tell you that there are 30 clinical trials conducted on Wegovy. One of them is the STEP 1 trial. And it was conducted on more than 30,000 people, actually. So very good evidence we have here. As you can see, after 68 weeks of use of Wegovy, people who were given the maximum dose, which is 2.4 milligram, they lost almost 17%, imagine. 17% of their initial body weight. Which is, for me, what is most important is that box on the left side of the screen. 1/3 of people on Wegovy, they lost more than 20% of their body weight. Imagine, 1/5 of their original body weight. We call them the good responders. And then we moved from Wegovy to the dual agonist, the Mounjaro, which is the tirzepatide. As you know, Mounjaro is a GLP-1 receptor agonist and a GIP at the same time. And the results were quite impressive, to be honest with you. This is the first time in history we have a medication that can result in 22.5% weight loss of baseline body weight after 72 weeks of use. This table, I just wanted to show you the comparison between the 6 different agents. The most expensive one is Mounjaro in terms of a price, but it is the most effective at the same time. And the least effective is Xenical, but it is the cheapest of them. The only one that is approved for management of obesity among young people and adolescents is the Wegovy, while Mounjaro is approved for the treatment of people with obesity and obstructive sleep apnea. But unfortunately, none of them is PPS subsidized. Now, is that it? Is there anything coming? Of course, medicine is evolving, including the battle against obesity. So we have many, many agents coming. We are looking for the oral Wegovy now. So oral semaglutide has been approved in December last year by the FDA, and probably is going to be approved in Australia soon. So Wegovy, oral Wegovy, is a single tablet that we take once daily in a dose of 25 milligram, and this can result in almost 14% weight loss after 64 weeks of use. And just couple of weeks ago, the FDA approved the Wegovy HD. HD Musikrin, HD is high dose. And Wegovy HD is 7.2 milligram. Imagine the current dose is 2.4, so this is triple the dose of the current Wegovy. But look at the result. According to the step-up trial, this Wegovy HD resulted in almost 20.7% weight loss after 72 weeks of use. Very impressive. I just wanted to show you how many items undergoing clinical trials in the battle against obesity, as you can see on this table. I wanted to shed the light on one of the most promising medication, is the triple agonist, retatrutide. It is a GLP-1 receptor agonist, a GIP, and a glucagon receptor. And very impressive result. Actually, now it is in the phase 3 clinical trial. 24.5%, up to 28% weight loss. Imagine your patient gonna lose 1/3 of their original body weight. So the gap is getting narrower and narrower between medical treatment and surgical intervention. So the magnitude of weight loss is different among different agents, but the results are quite impressive. And there are those who we can call them very good responders. They can lose more than 20%, 25% of their body weight. I think we are privileged by living in an era of unprecedented weight loss. And we started the journey by physical activity and lifestyle changes with very minimal effect. Now we have agents that can produce significant weight loss, such as the Wegovy and the tirzepatide or the Mounjaro, and yet to come more and more of these medicine. So the gap, as you can see, is getting narrower and narrower between medical treatment and surgical treatment of obesity. So I'm going to summarize my presentation. First of all, I think we agree we should think about obesity now as a chronic, relapsing, remitting disease rather than a risk factor for other diseases. This is very important. And second, we started our battle against obesity with monoagonists. Now we have the triple agonist, the retatrutide. And finally, the gap between medical treatment and surgical treatment of obesity is getting narrower and narrower. Before I finish, I just wanted to ask you, what is wrong with this photo? What is weird? So these are a couple of people going to the gym, but instead of using the stairs, they are using the escalator. Do you know why? That's probably true. I guess maybe they want to preserve some energy for the workout, especially if it is leg workout. Thank you so much.